Hi, I'm Dr. Vinatha. I'm a senior consultant in Cloudnine Hospital, Hitech City branch in Hyderabad. When to have a prolapse surgery? Not all women who have prolapse are bothered with that prolapse. Women who are bothered having discomfort, they are the people who should go for a surgery. But there are 2-3 times we tell women that they'll need a surgery. So what are those? When the prolapse or the lump comes down and it stretches the ureters. These are the tubes that come from kidneys to the bladder, and they can kink with the prolapse and cause kidney swell. Then that is the time we have to intervene and rectify the prolapse, either by using pessary or surgery, but they need a treatment. Or when someone has an ulcer, because this prolapse is long standing, it's outside, and there is an ulcer, it is very difficult to heal till you replace the prolapse inside. So for them, we will advise surgery. For rest of the times, it is for our discomfort that we go for a surgery. So this is the indications or when we have to operate. Second part of this question is how do we go about the post-op recovery? So we have a prolapse surgery and how to expect our recovery. The next thing is usually prolapse surgeries are done from vagina. They heal very quickly. Recovery is much better than anticipated. So rather than having an open cut or abdominal surgery like a cesarean or hysterectomy, this women will feel much easier to heal because there is no cuts outside. It is only inside. But very specific things is on the day of the surgery, you recover from anesthetic, you might feel pain, but we encourage you to get up and walk. So we will avoid complications like clots in the legs or clots sometimes going and blocking the lungs. So the important thing is mobility. As soon as possible, even if it's 6 hours, 8 hours, we can encourage women to get up and move. Usually we'll have a tube from the bladder. So because immediately you are not able to get up and go pass urine. That might stay for a day, especially for those whose bladders are repaired around the area. They might stay a little longer, but otherwise you can still hold the catheter bag like a handbag and walk. The next thing is you can eat and drink normally within 6 to 8 hours after surgery. First, we will give some fluids and see whether you are coping. You are not having nausea or vomiting after the effect of anesthetic. If you are tolerating fine, we can give you food. And if you have restrictions like diabetes or in hypertension, your food will be altered. Otherwise, you'll go into a normal diet within a day. So normal food, normal walking within 1 day. You're off all the IV lines and tubes within 1-2 days. And in the hospital itself, we want you to go pass urine and see whether that's happening fine. We want you to go pass motion and see whether that's happening fine, and you are fit to be discharged. After going home, make sure that you are following your routines as expected, in the sense avoiding constipation and making sure you are drinking enough, because each time if you have pain, you are not getting up and going, then you will reduce water intake, which is not going to do good. So make sure you are drinking plenty and going to toilet as needed. And next thing is a recovery from your routines. Within a week, your pain will be much better, tolerable. You're off painkillers, you're off antibiotics. So normal walking in the house and everything will be free within a week. The second week, you want to do some things like you're cooking or some clean. But make sure that whatever you are sitting and doing, standing and doing, these activities are fine. Lifting heavy weights. What is heavy weight? A shopping bag? Yes, that can be also heavy. Anything that is more than 3 to 5 kilos is heavy. So even a shopping bag can be heavier for you. So watch out what you are lifting. Bending will also cause strain on the pelvic floor. So these two things are the ones that you have to avoid for at least 6 weeks after a pelvic floor surgery, because this is a very sensitive area and we are prone for recurrence. So any good surgery should be followed by a perfect postoperative routine. And taking this care, like avoiding constipation, lifting weights, bending too much. So don't go and do the full cleaning work as soon as you are discharged from hospital. So some people are very interested in gardening. They'll ask, can I go back to gardening and everything? I think watch out what you are doing. So if you have to bend a lot and lift a few flower pots or anything, that's not for you in the first 6 weeks. Driving Yes, maybe after 4 weeks or 5 weeks, you can start. But if you are fine to do your emergency brakes and everything, you can start driving slowly. Check with your insurance. It might not be ready for 6 weeks after the surgery. So drive only after 6 weeks.